Hi, and thank you so much for agreeing to participate in my study on reversing metabolic syndrome. Just to give you a little bit of background on the goal of this study is I've created this online program in hopes of increasing your knowledge and awareness of what drives metabolic syndrome, of what leads to these issues. And then with that knowledge, I'm hoping for some behavioral changes that will then lead to improved biomarkers of metabolic syndrome. So maybe a lower waist circumference, maybe lower blood pressure, maybe better triglyceride numbers, those types of things. So before we dive into all of that stuff, let's talk about what is metabolic syndrome. So metabolic syndrome is one of, well, it's actually, you must have 3 of the 6 biomarkers to assess that your metabolism is off. So that can be high LDL cholesterol, low HDL cholesterol, high triglycerides. You could have hypertension. You may have extra weight around your middle, or one of the most telling things is some kind of blood sugar dysregulation. So high blood sugar, and that can be measured in a number of different ways, which I'll talk about here in a little bit. Our main concern is that metabolic syndrome is a precursor. It's telling us your metabolism is not doing what it's supposed to do, and you're on your way to type 2 diabetes. Some risks associated with type 2 diabetes include, so we see a lot of cardiovascular things: stroke, high blood pressure, atherosclerosis, eye problems, including diabetes-related retinopathy, foot problems, so leg and foot ulcers, gum disease or other mouth problems, sexual dysfunction, hearing loss, because we can definitely have some nerve damage from high blood sugar, constant high blood sugar, heart disease, kidney disease, liver problems, including non-alcoholic fatty liver disease, peripheral neuropathy, which again is we're looking at nerve damage, some skin conditions, which I will talk about some telltale skin conditions that will let you know long before you have full-blown type 2 diabetes that there's something off with the metabolism. Also, urinary tract infections can be another issue. So ultimately, our goal is to stop the development of type 2 diabetes in its tracks. And like we just talked about, just to reiterate the 3 of the 6 criteria, there's some numbers here. So waist circumference is over 35 inches for women, over 40 inches for men. We've got the cholesterol, the triglycerides, the blood pressure. And then I said we would talk a little bit more about blood sugar. And there's many different ways to measure sort of that the blood sugar is off. So you can either have a high fasting blood glucose, you might have high hemoglobin A1C, you might have measured a high fasting insulin, or we might have measured a high HOMA-IR test, which is kind of, I'll explain in a minute, but that has to do with insulin and blood sugar kind of together. So fasting glucose, that's how much sugar is in your blood after not eating for 8 hours or more. So that's the test that if you have a glucose meter, you could take this at home and check and see kind of if you're under that particular range. So, the goal is usually under 100, but there are some other pieces to that, which we'll discuss in a minute. One of the main things they like to use to diagnose blood sugar, too much blood sugar, is hemoglobin A1C. And so what this does is, here we have a red blood cell and we have a glucose molecule. So what it's doing is it's measuring how many sugar molecules are attached to you. So you have hemoglobin in your blood cells. So those glycated proteins or those sugar molecules attached to the hemoglobin. Okay. And we know hemoglobin is the protein that carries oxygen in your red blood cells. So these sugar molecules can stay attached to your hemoglobin until your red blood cell dies. And, red blood cells have an average life of about 16 weeks. So, give or take. What does that tell us? That means that the cupcake you ate 2 or 3 months ago is impacting your current health status. That's the bad news. The good news is you do make new blood cells constantly. So as you improve your diet and your lifestyle, your high hemoglobin A1C can become low and become very healthy. So that's two ways we can measure blood sugar and metabolism. One of the other things we can do is we can look at your fasting insulin. And um, insulin is a hormone that's responsible for putting sugar into your, or glucose into your cells. So we can look at fasting insulin and know if you have a very, very high number, then your body's working very, very hard to get a lot of sugar put into cells. The other thing we can do is we can look at fasting insulin and fasting glucose together, and that can give us a very comprehensive picture. Um, and you might be wondering why I have this picture. This is a skin tag, and I'll get to that in just a second. But so what a HOMA IR test does is it looks at that relationship between blood sugar and insulin, and there's a formula. So you take your fasting blood sugar times your fasting insulin, and you divide it by 405. The reason this is very helpful is because you may have a fasting glucose number that looks very good. But if your fasting insulin number is high, then we know that things are already starting to shift not in your favor. So if you look at the example, if we have a fasting glucose of 90, which is pretty good, and a fasting insulin of 4, still pretty good, and we do our little formula, 90 times 4 equals 360, and then we divide it by 405, we have 0.88. Any number under 1 is very good, okay? Now, if we look at this other person whose fasting glucose is actually lower, so they have a fasting glucose of 86, again, very good, but a fasting insulin level of 14, and we do that same formula, we're going to see that they have high risk. They're at 3.01. Now, the reason there's a picture of this skin tag on this slide is because skin tags, they have discovered, are one of the telltale physical signs before you do any testing or look at anything that shows you are developing a blood sugar dysregulation problem. So again, if you start seeing skin tags pop up, know that your insulin and your blood sugar are not doing what they're supposed to, and they need to be addressed. Okay, so I keep talking about insulin, blood sugar. Well, what is insulin? It is a hormone secreted by your pancreas. Okay, so your pancreas is very important in blood sugar regulation. Its job, so insulin's job, is to take the glucose or the sugar from your blood and help it to enter into your cells. When there's too much sugar circulating in the blood, it damages the vessels, okay? And it damages the vital organs, and it can increase your risk of heart disease, stroke, kidney disease, vision problems, nerve problems, etc. So you can see in the picture, here is a healthy pancreas making insulin. The insulin goes to the receptor. This receptor opens up this protein channel that then allows glucose to come in. In type 1 diabetes, the pancreas does not make insulin the way it should, so then it doesn't get opened up. And type 2 diabetes, usually at the beginning, your pancreas is still making insulin, but the glucose can't get in, and we'll talk about that here in just a second. But that is insulin. Its job is to go to the cell, open up the channel, and allow the glucose to come in. On the flip side of that, and we won't talk a lot about this, but you should know because they do work together, glucagon is a hormone that does the opposite. So your pancreas is also making this hormone, but it tells your liver to make glucose and put it into the blood when your blood sugar is low. So these two hormones work together to regulate blood sugar. So how does insulin work? Because I keep talking about it, and your pancreas is making it, and it's making this, the insulin to turn the key to allow in the glucose. So what happens in type 2 diabetes? Well, when your cell is already chock full of glucose, even when the insulin tries to unlock it, there's nowhere for the glucose to go. It can't get in because your cell is full of glucose. So insulin is knocking on the door of the cell, trying to get the key to turn, trying to open it up. And the cell is saying, do not enter, you cannot come in, there's no room, there's no space here. And this is how we become insulin resistant. So, just to recap, kind of the big thing, we know there are 6 markers for metabolic syndrome. It's cholesterol, triglycerides, waist circumference, blood sugar dysregulation, and then what is the main driving cause of all of this? Usually it's some form of insulin resistant. So that is it for this video, and hopefully that has given you a little bit of insight into how the mechanics of how blood sugar regulation works. Thanks, and I'll talk to you guys soon.